The emergence of lifestyle medicine. The history of health. There are people in history who have significantly contributed to improved healthcare quality that we have today. The first person, Florence Nightingale, was a nurse who is best known for her work on a military camp of British soldiers during the Crimean War in 1854. Florence saw that there were poor health conditions and high mortality rates, with up to 60% of soldiers dying due to infectious diseases. Florence introduced interventions such as reduction of overcrowding in hospitals, the removal of horses from hospital basements, the flushing of sewers several times a day, use of disinfection, and the provision of medical equipment, clean water, and food. Within 6 months of these interventions, there was a decrease in mortality from approximately 60% to 2.2%. The second person, Charles Chamberlain, he was a physician and a biologist who developed filtration known today as a Chamberlain filter. The filter has pores that are smaller than bacteria, making it possible for bacteria to be filtered from a solution. He then developed the Chamberlain autoclave, which destroyed microorganisms through heating solutions above boiling point, essentially developing sterilization, something that we still use today. Finally, Alexander Fleming. He discovered penicillin in 1928. Alexander was able to isolate the mold and identified it as a member of the Penicillium genus. He found it to be effective against all gram-positive pathogens, which are responsible for diseases such as scarlet fever, pneumonia, gonorrhea. Prior to the discovery of penicillin, though, the mortality rate from preventable illnesses or infections or minor injuries was very high. The mortality rate from pneumonia during World War I was 18% in soldiers. Interestingly, though, the current mortality rate from penicillin resistant pneumonia is 19.4%. So these three people have significantly contributed to improved healthcare quality that we have today. Whilst on the topic of penicillin resistance, there is a strong association with antibiotic use and the growing resistance worldwide. This is due to inappropriate use of antibiotics, the role in agriculture, and ongoing mutations of bacteria. This poses a threat to health worldwide, leaving us vulnerable to common infections today. Despite this, the leading cause of death worldwide today is chronic disease. Chronic diseases account for up to 71% of deaths globally every year. The World Health Organization explains that chronic diseases are not passed from person to person. They are of long duration and a generally slow progression. The four main types are cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. Risk factors for chronic disease include poor diet, poor nutrition, physical inactivity, smoking, and alcohol abuse. This graph shows us the 10 leading causes of death in the United States in 1900 and 1997. As you can see in the first graph, the top three leading causes of death: tuberculosis, pneumonia, diarrhea. These are all infectious diseases, whereas in 1997, the percentage of infectious diseases is significantly less, whereas heart disease, cancer, stroke, and chronic lung disease, the top four leading causes of death, are all chronic diseases. There is a significant difference between 1900 and 1997. This graph shows us the number of people with chronic conditions from 1995 to an estimated in 2030, and you can see there is a rapid increase from 1995 of 44.7%, or 118 million people, compared to what is estimated in 2030 with 49.2% and 171 million people to be estimated to have chronic conditions. So, what are these risk factors that make us so susceptible to these chronic diseases? There's smoking. Smoking is estimated to cause about 71% of lung cancer, 42% of respiratory diseases, and nearly 10% of cardiovascular disease. Alcohol abuse. Approximately 2.3 million people die every year from the harmful use of alcohol, accounting for about 3.8% of all deaths in the world. More than half of these deaths occur from chronic diseases, including cancer, cardiovascular disease, and liver cirrhosis. Poor diet and poor nutrition. Adequate consumption of fruit and vegetables reduces the risk of cardiovascular diseases, stomach cancer, and colorectal cancer. High salt consumption is an important determinant of high blood pressure and cardiovascular disease. And finally, physical inactivity. People who are insufficiently physically active have a 20 to 30% increased risk of all-cause mortality. Regular physical activity reduces the risk of high blood pressure, diabetes, breast and colon cancer, and depression. It is clear that our daily habits and behaviors significantly impact our short and long-term health and quality of life. So this is where lifestyle medicine comes in play. What is lifestyle medicine? It's an evidence-based medical specialty that uses lifestyle therapeutic approaches to prevent, treat, or modify chronic diseases, the disease area that accounts for 71% of deaths worldwide. In other words, lifestyle medicine involves employing lifestyle changes and interventions predominantly to prevent and manage chronic disease. The power of a healthy lifestyle and daily practices has been demonstrated to have a positive impact on both short and long-term health and overall quality of life. So some of the modifiable lifestyle habits include quitting smoking, being physically active, having a healthy diet and nutrition, and having adequate sleep and rest. Cardiovascular disease. It's the leading cause of death globally. According to the World Health Organization, an estimated 17.9 million people died from cardiovascular disease in 2016. That's representing 31% of all global deaths. And of these, 85% are due to heart attacks and stroke. So as you can see in this picture, cardiovascular disease in Australia, 54,000 Australians suffer a heart attack every year. $7.6 billion in healthcare every year. One Australian dies from cardiovascular disease every 12 minutes, and 24 women die from heart disease every day in Australia. So due to the prevalence and the significance of cardiovascular disease, not only within Australia but worldwide, let's just have a look now. Let's focus on lifestyle medicine and cardiovascular disease. So lifestyle changes have been found to play an important role in the prevention of cardiovascular disease. Risk factors include high blood pressure, diabetes, and it can be modified by lifestyle changes. Research has shown that changes in diet, exercise, and stress management can actually reverse cardiovascular damage.
Whether it's coronary artery disease, high blood pressure, cardiac arrest, or congestive heart failure, doctors say for many patients, all forms of heart disease can be prevented.
We do about 1,100 open heart surgical procedures here annually. We're seeing them every day.
Cardiothoracic surgeon Dr. Brian Hummel says nearly 600 of those procedures performed every year at Lee Health are coronary bypass surgeries.
Of those patients, a significant percentage could have been perhaps avoided or delayed a significant amount of time had they done something lifestyle-wise.
That means adding at least 20 minutes of physical activity to your daily routine and taking out foods that are high in sodium, fat, and sugar.
Eating right can certainly help avoid cardiac problems or cardiac disease down the road.
Keeping up with your annual doctor's appointments and monitoring your weight and lab work can also help patients address any changes to their heart health.
Watch your cholesterol and triglycerides, the fatty foods, so that the red meats, that sort of thing. There is a lot of evidence that a plant-based diet really does lower your cholesterol and lowers the risk of heart disease.
And the number one thing doctors recommend to prevent heart disease is to stop smoking.
Still, people continue to smoke, and it is the number one problem in terms of people developing heart disease.
Lee Health was recently chosen as one of the top 50 cardiovascular programs in the nation. Doctors say improving your lifestyle can benefit your heart health and keep you here instead of here. For Lee Health, I'm Lindsay Morton.
cardiovascular disease. So here we have 7 heart healthy tips. 1, get active. 2, stop smoking. 3, maintain a healthy weight. 4, know your numbers. 5, eat healthily. 6, know your warning signs. 7, take your meds. So we're going to look into the top 5 heart healthy tips. Number 1, get active. Just 30 minutes of exercise a day can help prevent heart attacks and stroke. Regular physical activity decreases the incidence of cardiovascular disease. Adequate physical activity is associated with reduced mortality rates of cardiovascular disease by 35%. It is recommended that 30 minutes of moderate intensity exercise 5 to 7 days a week can significantly reduce the risk of mortality due to cardiovascular disease. 2, quit smoking. Your risk of coronary heart disease will be half within a year of quitting smoking. A study found that smoking was a significant risk factor and contributor to cardiovascular disease. Smokers were twice as likely to die due to cardiovascular disease compared to those who had never smoked. An individual who smokes only 4 to 6 cigarettes a day is twice as likely to die due to cardiovascular disease, whilst an individual who smokes 25 or more cigarettes per day is 5 times more likely to die due to cardiovascular disease. 3, maintain a healthy weight. Keeping a healthy weight is key in controlling your blood pressure and lowering your risk of heart disease. Obesity is an ongoing issue in Australia and is a risk factor associated with cardiovascular disease. 70% of men and 56% of women are overweight or obese based on BMI scores. 25% of all children aged 2 to 17 years are overweight or obese. And cardiovascular disease is 3 times more likely in individuals who are overweight compared to those that are within a healthy weight range. Losing weight and maintaining a healthy weight has been associated with improvement of pre-existing risk factors for cardiovascular disease such as hypertension and diabetes. Know your numbers. High blood pressure is the number 1 risk factor for stroke and a major factor for around half of all the heart disease and stroke. Elevated blood pressure significantly increases the risk of cardiovascular disease. A systolic blood pressure of 120 is considered healthy, and lowering your blood pressure by just 10 reduces your risk of cardiovascular disease by 20%, of coronary heart disease by 17%, stroke by 27%, and heart failure by 28%. Diet, exercise, and medications all contribute to keeping a low blood pressure. 5, eat healthily. A diet low in saturated fats and rich in fruit and veggies can lower your risk of heart disease by 73%. Studies have indicated that dietary changes such as low intake of trans fat and glycemic load and the high intake of cereal fiber, marine N3 fatty acids, folate, and a higher intake of polyunsaturated compared to saturated fats are associated with a reduced risk of cardiovascular disease. There is an established link between fruit, vegetables, and whole grain and the protection against cardiovascular disease. In summary, lifestyle medicine is key in preventing, managing, and reversing some chronic diseases of today. Thank you for listening.